I awakened this morning with his spirit deeply on my mind, simply to tell his story as I commit my life to doing this. BMI gone too soon. Muscularly built, young man, in my opinion, just my age actually. Muscularly built, BMI 27, just the epitome of walking health, one would think, from looking at the outside. But he simply presented a month before with complaints of cough. And the doctor early on was just claiming that it was sinus problem or congestion and nothing to worry about. But yet he continued to present with complaints of shortness of breath and cough to the point where it led him to the emergency room. And at that point, he was noted to have tumor all over his body, stage 4 cancer. And his heart was basically encased by tumor as they attempted to remove some of the fluid off of his heart. He dies just a few hours later before chemotherapy would be initiated, as they were contemplating chemotherapy. I say all this to say, before I show these slides, that I posted that video stating that patients can be in the driver's seat of their care by knowing their lab status. And now, even today, one can get their own CT. One can receive their own CT scan by ordering it themselves to see if they have early cancer. So before it's so advanced and basically too late. As again, this person was being scheduled to start chemotherapy before he died. And believe you me, it may have been a good thing that he didn't have to suffer much more longer with chemotherapy. But I say all this to say, as I began to show these slides, that it's going to be you, patient, to take inventory of your own health. Get your lab studies done after 50, and sometime even before, in the 40s, if you got early history of cancer. And also get your CT scan imaging. You don't know your status. I just told you that this person was BMI 27, the walking epitome of health, as our society say. As long as you do diet and exercise, you should live. Well, this person thought he was all right doing that and dies of advanced cancer. But I wanted to show you these various slides as I highlight here. The first slides above, I think the first 3 slides are lung images, and I wanted to show the gross images of it as you see it from the slide anyway, where the tumor is in lymphatic and vascular channels. The second slide shows cancer around the bronchus. The third slide, cancer of various pattern within the lungs. And I wanted to highlight that point too, because oftentimes pathologists get a kick out of trying to figure out if it's adenocarcinoma, neuroendocrine tumor, so forth and so on. At the end of the day, this diagnosis that I present on this slide is carcinomatosis. It has both adenocarcinoma features and neuroendocrine features. But the point of the matter is, this tumor is all over his body. And it doesn't matter if it was primary adenocarcinoma or primary neuroendocrine carcinoma or mixed tumor, the patient is dead. And so I hope, and I realize that we're still doing the same thing in pathologists. After 30 years of being in this field, we're still diagnosing cancer in very advanced stages and getting a kick of trying to figure out if it's this primary, that primary, which pattern of a tumor it is. At the end of the day, it's cancer. And advanced stage cancer is advanced stage cancer. I don't think it requires so much diagnostic workup to see if it's adeno, neuroendocrine, small cell. It doesn't matter. Cancer is cancer. And so as I take you, and so as I continue to go down, then the fourth slide is one of cancer within the heart muscle, myocardium, left ventricular. Then you're going to see cancer around coronary arteries and even inside coronary arteries. You see, and those are the next two slides. And then there's cancer around the aorta, the large blood vessel that comes off the heart. Then there's cancer, more cancer in the coronary arteries, more cancer in the heart, cancer extensively involving the liver. And then there is cancer in a scraping of bone marrow. I just simply took a scrape of the rib, and lo and behold, there is cancer in that bone marrow scraping. And that's why I always do scraping of the ribs to look at the bone marrow, because even in that little scraping, there is metastatic cancer in the bone marrow. So let me pause now to show you the images.